If you ever tried switching your Medicare supplement plan, you might have been surprised when the insurance company asked you health questions or even denied your application. You might be thinking, why does that happen, or what exactly are these companies looking for? Now let's talk about some common conditions we see all the time and whether the carriers usually take them or not. High blood pressure or cholesterol, totally fine as long as they're controlled with medication. Diabetes is typically okay if you're taking oral medication and only a couple blood pressure medications. If you're using more than 50 units of insulin per day, that can be an issue with most carriers. Or if you have diabetes with a history of heart conditions like heart attack or stroke, that also can narrow the carrier selection down quite a bit. If there is even going to be a carrier to use in that situation, it's going to be rare. Again, heart attack or stroke in the last 1 to 2 years can trigger a decline. Sleep apnea is usually fine as long as there's no oxygen or supplemental oxygen being used if you're using a CPAP machine. Depression or anxiety medications, generally okay if you're stable and there's no hospitalizations due to depression or anxiety. If you're seeing a psychiatrist 1 or 2 times a year, that can actually narrow the carrier selection down a little bit. Another one we see a lot is injections. So if you're getting injections at a doctor's office, a lot of carriers won't take that, but some will. So it really depends on your situation. You do not want to go out and just apply for random carriers, because once you start getting declined, that can eat up a lot of time. It can go on your record. It can cause issues. So if you're looking for a lower rate, again, give us a call at the number below. We'd be glad to help you out.